So welcome to our Grand Rounds presentation. I'm Katie, and
I'm Kaz.
but in this hypothetical scenario, we're Dr. Burton and Hirata. We're going to be talking about a case of a 48-year-old man with weakness of his limbs and multiple tumors of his spinal nerves. So for a brief case summary, talking about how the patient presented, like I said, it's a 48-year-old man who was evaluated in a neurology clinic because of weakness in his arms and legs. At age 18, the patient had been diagnosed with Recklinghausen's neurofibromatosis, and we'll talk a little bit more about what neurofibromatosis is later on. But after a biopsy of a mass in his neck, and then at age 45, the patient had pain and weakness in his left leg. And a MRI showed that the patient had a tumor in his knee that grew and ended up pressing on the sciatic nerve and causing more pain and weakness. After 3 months of that tumor, the patient had even more increased pain and foot drop. And oops, I can't see this. Oh, the patient showed lesions in the neural cervical foramina and the thoracic lumbar spine. So you can see a photo of that MRI on the right. And the patient was treated with gabapentin, which is a nerve pain medication. So that was kind of a short-term treatment to deal with the symptoms. And then after a year, the patient came back and his limbs were still weak, still didn't have any abnormalities in the brain, which was good. But the patient had tumors in the cervical spine, and they had grown and they were continuing to compress on the patient's spinal cord. So there were some other symptoms that we'll talk about later, but the main question that we have is what type of neurofibromatosis does this patient have? We know that neurofibromatosis is a condition that causes tumors, usually benign, to grow in, grow in the spinal cord and in the brain. But there are some, the patient kind of falls between a few types of neurofibromatosis. The main question is what type would the patient be diagnosed with?
Okay, so the first possibility is neurofibromatosis type 2, which would demonstrate vestibular schwannomas, which is a tumor that develops on this balance and hearing or auditory nerves by your inner ear to the brain, which is shown in the picture on the slide, which was rejected because it was not detected on the patient. Second possibility is neurofibromatosis type 1, which would demonstrate at least two of the following: the presence of multiple neurofibromas, at least 6 cafe au lait spots, which is this brown spot shown in this picture on your skin usually, and axillary or inguinal freckles, rich nodules, which are these very similar to cafe au lait spots, but not on your skins, but usually on the patient's iris, just brown spots on people's eyes. Skeletal dysplasia, which is typically people describe it as dwarfism. It's just the bones are not growing very well, and just usually like not a proper growth of the bones. And optic glioma, which is this very slow developing tumor on people's brain. And neurofibromas type 1 was rejected because patients only fulfilled one criteria, which is the presence of multiple neurofibromas. The patients also had some cafe au lait spots, but he only had 2, which is not enough, not 6, not enough to fulfill this second criteria to be diagnosed with neurofibromas type 1.
So there was a third possibility, which was familial spinal neurofibromatosis, which is usually demonstrated by spinal neurofibromas, cafe au lait spots, no dermal neurofibromas, and they would have an NF1 gene mutation because this is a hereditary version of neurofibromatosis. So the patient did have cafe au lait spots, but not enough to meet the criteria for diagnosis. So that kind of left them in the gray area. And then also, initially, the NF1 gene mutation hadn't been tested, but they knew that the sibling of the patient and the nephew, and I believe the aunt, all had displayed symptoms of neurofibromatosis or had died from neurofibromatosis. So that gave them an idea that the disease may have been hereditary. And eventually they tested the NF1 gene, which did find abnormalities on exon 22, which is a kind of telltale sign of familial spinal neurofibromatosis. And ultimately we concluded that the patient's condition would fall somewhere between neurofibromatosis type 1 and familial spinal neurofibromatosis. The reasoning being kind of what we just explained. The patient had similar tumors to people with familial spinal neurofibromatosis, but didn't have enough cafe au lait spots to diagnose. And the patient nearly met all of the criteria for generalized neurofibromatosis type 1. The kind of conclusion here is that there may be more of a spectrum of manifestations of the disease. So it may not, people's presentations may not always fall into the strict boxes of kind of type 1, type 2, and familial neurofibromatosis. It could be more on a spectrum. So the conclusion is that the patient falls somewhere in between.
So NF1 gene test was not initially done, but in the section of pathological discussion, it was later discussed, and as Katie said, it was the exon 22 was found to be the abnormalities of the genes, which was crucial to the final conclusion of the diagnosis. Future diagnostic procedures that could be included would be additional DNA test, specifically on NF1 gene test on the patient's relatives, including his nephew and his nephew's mother, who is his related sister. The problem there is his sister. By the time the patient's gene was tested, his sister was already, she passed away because of just an accident. I think she fell down the stairs and just passed away. But also, I think because of that, they checked her, body, and I think they found some tumors along her spine, and his nephew also said she had some brown spot. With also nephew himself had some, and his maternal half brother and half sister also had brown spots according to the nephew, which is suspected to be cafe au lait spots. And also the nephew himself shows a lot of symptoms that would fit into be diagnosed as him having neurofibromatosis. So having those additional gene tests would help conclude even more that patients have some sort of neurofibromatosis.
That's you, sorry.
Yeah. So the treatment for neurofibromatosis, regardless of the types, is typically the removal of the tumors. The expected outcome is the recovery of motor function and diminished pain obviously because physically removing the tumors from those areas that's the tumors are touching the nerves would, removing those would obviously help recover the function of the limbs and relieve pain.
And then some kind of interesting clinical anatomy we wanted to talk about. The kind of mechanism of the disease here is that the NF1 gene produces a protein called neurofibromin, and that usually helps regulate cell growth. But if there's a mutation on exon 22, which this patient did have, then that can cause a lack of neurofibromin, and that therefore would lead to uncontrolled cell growth, which kind of manifests as tumors, and ultimately neurofibromatosis. Also, the presence of kind of the cafe au lait spots on the skin can be explained by that same exon 22 mutation, which causes a pigmentary kind of change in certain areas of the skin. So that's kind of why they were able to use those symptoms as kind of markers for neurofibromatosis. It all kind of comes down to the exon 22 NF1 gene mutation. And those are our references.
Oops.
Are there any questions?
Let anybody else ask one first. I have a few.
I have a question actually, if you don't mind. Just to clarify, are the cafe au lait spots like on the skin? I think I saw.
Yeah.
All right, thank you.
Anyone else? So, what cell type is this that's having this problem? It's called neurofibromatosis. These aren't nerve cells, are they? Or are they connective tissue?
I believe they're connective tissue within the lumbar spine and cervical spine.
Yeah. I think it usually grows by the nerves or on the nerves.
Mm-hmm.
And the tumors would usually press on nerves. So I believe that it wasn't actual nerve cells that were losing cell growth control.
Is it a type of glial cell that is having this issue? Because that's another option, right? You were talking about vesicular schwannomas. You were talking about, I think Tiger was talking about that, and then gliomas. Is it a subset of that category, or you're not exactly sure whether it was that or like dura or some sort of?
I'm not sure.
I think when I looked it up initially, it talked about like Schwann cells or something, but I wasn't very sure what exactly that was.
Are all of the types of neurofibromatosis familial, or are some of them sporadic? Like that, it wasn't especially clear when you were talking about the spectrum. I didn't understand whether there was how it can be that dichotomy, whether that is how that is a spectrum.
I believe some of them are sporadic if there's just kind of not a non-hereditary mutation to that gene, but it also a lot of times is hereditary. So there.
I think familial one is like a variant of type 1. So a lot of the ones that's close to like the box of type 1, that like the ones that is like similar to the symptoms of that type 1 could be hereditary, but I don't think not all of them are.
Okay. Well, thank you very much.